University of Alberta, and I'm pleased to welcome you to the fourth talk in CUP's Issues and Impacts series today. I'll start with some information about our session. There are many participants registered for today's talk, so to make sure the technology runs smoothly, we're disabling your microphones and cameras. This way it will be easier for you to see and hear our speaker. We will spotlight Dr. Buschmann during the talk, so you should not have to make any adjustments to your screen. This talk will be recorded and of course will include the slides. That recording will be available on the School of Public Health's YouTube channel. We will put the link to the channel in the chat box, as well as our follow-up email to you through Eventbrite. During our last talk, we had a Zoom bomber gain entry and we promptly removed them. We've developed a process amongst our support team to deal with this, so please hold tight if we have any unexpected interruptions. I will be the moderator for questions at the end of the talk, and we encourage you to put your questions in the chat box at any time throughout the talk. I want to start our time together today by recognizing and speaking to the land in which we're meeting. There are likely participants on our call right now from various locations that reach across the traditional territories of many Indigenous nations. Honoring the land we're on and the footsteps that have walked these lands before us grounds us and acknowledges the importance of relationships. I want to acknowledge the land on which I am standing and the wisdom and footsteps that have marked it for generations. And I encourage you to do the same. The place where I live and join you from today is acknowledged to be the territory covered by Treaty 6 and Region 4 of the Métis Nation of Alberta, a traditional meeting ground and gathering place and traveling route for many Indigenous peoples for centuries. And by acknowledging this territory, we respect the history, languages, and cultures of First Nations, Métis, Inuit, and all peoples, First Peoples of Canada, that enrich our vibrant communities. A treaty is an inheritance, a responsibility, and a relationship. And we are all treaty people, beneficiaries of the peace and prosperity the treaty brought, and committed also to working towards the equity and justice the treaty promised. May recognizing our status as treaty people help us to be good neighbors to one another, good stewards of the land, and good ancestors to all our children. I know there are many people on the call today who know CUP, but there may be a few who don't. So I'd like to take a moment to tell you about CUP and our series. CUP is a research center housed in the School of Public Health at the University of Alberta. And for the past 20 years, CUP has worked closely with community organizations, researchers, practitioners, funders, and policymakers in Edmonton and across Alberta to identify issues of concern to the well-being of children, youth, and families. In response to those issues, we collaboratively create research and evaluation projects, generate evidence and mobilize it to improve practices, programs, and policies. We have numerous community partners who have been on this journey with us from the beginning, and we would not be who we are without them. The Issues and Impacts series is a way for CUP to celebrate, bring attention and discussion around issues that are relevant to our current research partnerships with communities. Each segment of the series engages field experts who speak to a current issue of concern related to one of CUP's priority research areas, and then local partnerships that provide a more intimate discussion of local projects working to understand and achieve impacts on that same issue. In December, we focused on community-based participatory research. 2 weeks ago, we had a fabulous conversation with Kathleen Flanagan, and today we finished this segment of the series focused on the issue of early learning and care. I am very pleased to welcome our speaker today, Dr. Rob Buschmann. Rob is the Policy Research Associate at CUP. His current work focuses on early learning and care policy in Edmonton and Alberta, and more broadly, on how to conduct community-engaged research that contributes to public policy discussions. He's currently CUP's representative to the Edmonton Council for Early Learning and Care, an organization with the vision of early learning and care for all children that is high in quality, universally available, accessible, affordable, and responsive to the diversity of individual children and their families. Rob has co-authored a profile of Edmonton childcare in 2019 and several other briefs and reports intended to help guide the work of the council. Before coming to CUP, Rob worked in community-engaged health research in Galveston, Texas, and in public policy research and analysis in a wide variety of areas in Washington, D.C. He obtained his PhD in population health sciences from the University of Texas Medical Branch in Galveston, Texas, and his master's in public policy from Duke University in Durham, North Carolina. Dr. Buschmann also has undergraduate degrees in history and nursing. And I'm super pleased to welcome Rob today and to share his screen.
Hi, everybody. So thank you so much for that, Karen. I really appreciate it. I'm going to share my screen right now to get my presentation started. Let's see. Sorry, there's so many things up here that I need to move things around. And let's start there. All right, so my presentation today is titled Local Matters, Addressing Early Learning and Care in Edmonton in 2021. And again, I'm Rob Buschmann from a research associate at CUP. I like to start my presentations with sort of a who am I? Karen has given sort of a presentation on where I've been and kind of my education. I like to show pictures of where I am. I came from Galveston. On the left, you see a picture of Galveston. That's the Gulf Coast, and it's a very nice day there in Galveston. That's where I first encountered early learning and care as a parent. In fact, my child entered early learning and care at 4 months old and has been involved in it ever since. And it was very easy for her there to pretend she was Ariel. I moved up here to Alberta, to Edmonton in 2017, where I'm learning early learning and care as a researcher and policy analyst. I'm still living early learning and care as a parent, even as my child has gotten a little older. And now really the big functional difference is my daughter finds it much easier to pretend she's Elsa. So the community partner that I work with a lot in the Edmonton Council is the Edmonton Council for Early Learning and Care, the ECELC. Karen shared their vision earlier. I would also like to note that the ECELC is part of End Poverty Edmonton, which is a community-based effort here in Edmonton, which seeks to end poverty in the city within a generation. CUP is an organizational member of the council, and I'm their representative right now. And much of the work that I'm going to present as we go here has been done in collaboration with the council. But I want to make it clear that I'm not speaking on behalf of them right now. It's really just me. So from time to time, I'm going to have Kathleen, a couple of slides from Kathleen's presentation in there in this presentation, because I liked them so much and I wanted to make sure that people saw them again. This is a slide that was on early indications of what Canada's sort of national childcare efforts, what they're leaning toward. And I like this because it sets up the rest of my presentation, to be honest. It's a focus on quality, affordability, access, flexibility, and inclusion. The federal or the national plan will respect provincial or territorial autonomy, which means that there's still, of course, a lot of work to do locally. There'll be learning from Quebec's model and could be a multi-pronged approach, which is also what I'm going to sort of recommend or talk about here. So what we're going to see here in this first part is sort of Rob's whirlwind view of early learning and care in Edmonton, and in some cases in Alberta as well. So I'm going to start with availability. And when I think of availability, or I try to conceptualize it, most of the time I think of spaces per child eligible. And so when we ask the question, how available is early learning and care, what I abbreviate as ELC in these slides in Edmonton, when I think about full-time licensed daycare, or essentially programs that that are for children that take the whole day. There's one space in Edmonton for about every 3 to 4 children, and I'm being mushy there because the data don't tend to match up great. So when I say one space for every 3 to 4 children, I'm talking about children aged 0 to 4. And the best that we have right now for the City of Edmonton are 2016 population numbers. Spaces we actually have up till 2020. So when I say one space for every 3 to 4, I'm matching 2016 data to 2020 spaces, which might actually make it look better than it actually is. The other issue is that I'm talking about licensed capacity. That's not equal, and we can talk about this later, to actual spaces available. Programs might be licensed for 100 spaces, but they might only have 80 spaces that they can actually make available for any number of reasons. The other issue here when we think about availability are childcare deserts. So when I say one space for every 3 to 4 children, that's not uniform across Edmonton. There are places where that's better and there are places where that's worse. And I'll show you in a picture in a minute that kind of gives you a sense of that. And the other sort of big unknown here is the amount of unlicensed care. So things like nannies or day homes that have fewer than 6 children in there. We actually don't know anything about this type of care in Edmonton, and more broadly in Alberta, we actually don't know much about it at all. So it's kind of an unknown when we think about availability. I'd also like to mention that there's preschool programs. There's a little more than 2,800 spaces in Edmonton. These are center-based programs that provide part-time care, so 4 hours or less. And an interesting thing about preschool, at least for me, is that since 2016, the number of programs and spaces available in Edmonton and Alberta have actually decreased. That's in opposition to pretty much every other type of early learning and care in Edmonton and Alberta. So here we see a picture of Edmonton from a childcare desert perspective. What you'll see here, the big thing to point out is that it's not even, right? So the colors here range from green, which is above 50%, which means there's one space for every 2 children, to orange, which is below 50% to various levels, which is more than or less than 1 space for every 2 children. And you can see that there's sort of a shape where the center of Edmonton seems to look better. And then around the ring, it tends to look a little worse. But I would also remind people that this is 2016 population data with, I think this map was created with maybe 2018 or 2019 space data. So again, this looks a little better, I think, than it is in reality. So finishing up availability, we also have out of school care. So this is care for school-age children before and after school. My calculations for this tend to give 1 space for every 5 to 7 children. Again, it's matching the data that tends to be a bit of a problem, but that figure includes children aged 5 to 11. And then the last sort of measure of thought that we have about availability is what about wait lists? These are the things that all parents encounter and get kind of freaked out about. The issue with wait lists is they aren't formally measured or monitored in Edmonton or Alberta, so most of what we know or understand about it at this point is sort of anecdotal. And they can be a helpful way to understand availability, but they can also be misleading because a single child can actually be on multiple wait lists. And within a particular program, there can be wait lists for some age groups, but not for others. So we have to use and understand wait lists sort of carefully. So that's my whirlwind of availability. The second aspect that I'm going to talk about is affordability. And when we talk about affordability, the first thing that always comes up are fees. How much does it cost? How much does early learning and care cost? So on the left here, you'll see 2019 numbers, median numbers for costs. They range by age group because they differ. So infants, toddlers, and preschoolers. And then unfortunately, we actually don't have any data for out of school care. So I couldn't tell you how much that costs. So that gives you a sense of where we're at for cost. That's 2019. Hopefully 2020 numbers will be coming out soon. On the right, what you see is percent increases in each of those numbers since 2014. And this sort of Christmas themed sort of idea is to point out that for infants and preschoolers, it's gone up a lot more since 2014 than it has for toddlers. And then on the very bottom is inflation in the Edmonton area. So you can see here that for two age groups, it's actually outstripped inflation by a considerable amount. When I'm sort of thinking about affordability, and this is a slide from Kathleen's talk that I really like. How do we put that in context? Well, one way is to compare it to how much other things cost. And in this case, what Kathleen did is looked at 4 years of childcare versus 4 years at the local university. So you'll see Edmonton childcare and the University of Alberta, and then Calgary childcare and the University of Calgary. And in both cases, 4 years of childcare are more expensive than 4 years of the local university. So I thought that's a good way to understand it. But if you want to look even deeper and you want to be a little dorky about it, you can look at it like this. Now, this is kind of a complicated slide, so I'll walk you through, but this is the way that I like thinking about and thinking through affordability. So what we're looking at here is a sample family. And this family lives in Edmonton. They have one infant and one preschooler in median cost childcare, which comes to a little less than $2,000 a month. So what we're looking at here along the bottom is annual income of this family. So we're looking at it at different incomes. And then on the side is the percent of that income that they're spending on early learning and care for these two children. So this is the blue line. And I want to just have everybody concentrate on the blue line for a minute. Going from left to right, that blue line is what happens to the percent that this family's spending of their income they're spending on early learning and care, essentially as they get richer or they make more money. So you can see that there's certain points there that I've sort of highlighted, and I'll get to those in a second. But the idea, what's interesting about this blue line is it's kind of a crazy roller coaster shape, right? And the reason that it's a crazy roller coaster shape and not like kind of a smooth line is that we have subsidies for lower income families in Alberta. This is a good thing, but it makes this line weird. And these kick in at 75 or just under $75,000 of family income a year. So again, ignore the red and the green line for a second. I'll get to those, but what I want to do is I want to start at what's marked at 15.7. And that is sort of what I would call for this family, this sort of early learning and care affordability sweet spot. This is where they're making enough money to still get the full subsidy for childcare or for early learning and care, but they're not making, but they're making, so they're bumping up at the very edge of it. So in Alberta, families that make less than $50,000 get a full childcare subsidy. When I say full, that doesn't mean it covers all of the costs. So that's why you're seeing here a 15.7. This family is getting the full subsidy, but they still have to pay 15.7% of their annual income for these two children to be in care. If you follow along to the left, you'll note that this gets higher and higher. And this is the reason this happens is that there is a cap on the subsidy that a family gets. So what that means in practice is that a family who makes $45,000 a year gets the exact same dollar subsidy for each child as a family that makes $25,000 a year. But of course, that family with $25,000 a year has $20,000 less to spend on everything. So when you see 28.3 to the left, that's how much that family making $25,000 a year makes or spends as a percent. If you go to the right from 15.7, you see the subsidy kind of phasing out. So there's a partial subsidy for families between 50 and 75. You see it sort of gently go up, and then at 75, it pops up to 31.6. And then that is the point at which that family has lost all their subsidy. And then it sort of gently goes down as the family makes more money. The reason I went through all of this is that I'm going to come back to this later when we talk about options. So in summary, how affordable is early learning and care in Edmonton? Well, here's some of the main points to take. Fees have been generally outpacing inflation since 2014. 4 years of care in Edmonton costs more than 4 years at the University of Alberta. And one point to remember in this is that early learning and care is typically paid by younger families that are nearer their beginning of their careers. With 2 children in early learning and care, like the sample family that I diagrammed there, the best you're going to get is about 15% of your before tax family income spent on early learning and care. And another point to keep in mind, in fees and subsidies are both calculated in sort of a per child, meaning that larger families will always pay more for care in Alberta. And I would just say that that's in contrast to, say, the public K through 12 system, where that's not the case. So the third aspect on our World One tour is quality. And if you thought availability and affordability were complicated, now it gets really bad. But in trying to get our arms around quality at the program level, I would note in Edmonton and Alberta, there sort of used to be 3 easy ways to try to think about quality at a program level. Licensed programs, accredited programs, which were about 80 to 90% of all licensed programs were in fact accredited. So this is a somewhat higher level, broadly speaking, of quality. Programs had to do a little more, and they got a little more support for their workforce. And then ELCCs, or what is colloquially known as the $25 a day programs, and there were 122 of those in the province. But as of April 1st of this year, both accreditation and ELCCs will no longer exist. So that limits our ability a little bit to know, at least on a surface level, to distinguish quality in programs. That said, there's a new Early Learning and Childcare Act and regulation in Alberta, and it now incorporates guiding principles and matters to be considered in the Act. And incorporates risk-based licensing. But these are very new, so we don't really know kind of how they're going to play out or how we're going to look at. So if we don't have that, how do we look at quality? Well, one of the ways that I think through quality is to think about how's the workforce doing. And so one of the things that we know in Alberta is how many people meet certification levels. So in Alberta, there's 3 levels of certification for early childhood educators, that's ECEs. What is now known as a level 1, or child development assistant, is what it used to be called. Child development worker, which includes a 1-year post-secondary certificate or equivalent, and then a supervisor, or level 3, which includes a 2-year, or which you need a 2-year post-secondary diploma or equivalent. And this is sort of how the workforce breaks down in Alberta. You should have sort of 40% at this level 1, a smaller percent, 15, sometimes 20 in the past at worker or level 2, and then another 40% at the supervisor level. One other thing to know or to think about when looking at the workforce is wages. So here we see level 1, level 2, level 3 again. What I've circled in red over there is the average wage with provincial top-up. So there's employer paid wages, and then in Alberta, there are wage top-up rates that correlate to what level of certification that educator has. So you can see, even with the top-up on the far right, if you look at the 2019 average Alberta wage for all industries, it's a little under $30 an hour, and all early childhood educators at all levels fall under that. Some of them well under that, even with the wage top-up. And then we do know a little bit about early childhood educators in Edmonton. This is just a quick look to kind of give you a sense of the workforce locally, and then the frontline workforce compared to Alberta. So you can see, and this is no surprise, that the workforce is almost entirely female in the front line. In Edmonton, only 37% of folks who answered the survey that a lot of this information comes from were actually born in Canada. You can see both in Edmonton and Alberta that there's a fair number of people who are frontline educators who actually worked outside of early learning and care in the past 12 months, so had a second job or an additional job. And then 90% of educators felt valued and respected by parents, but that drops a fair amount to 58% in Edmonton and 60% in Alberta. And then looking at average annual salary in Edmonton, it's just under $30,000. This is from 2019. It's just under $30,000 a year. In Alberta, it's just under $35,000 a year. So this sort of gives you an overall sense of the workforce. So if we return back to our question of quality, and there's a lot that I haven't gone over here because we're doing this sort of whirlwind tour, some takeaways are that early childhood educators in Alberta sort of vary in certification levels. Certification is kind of a rough approximation of education, but it doesn't include things like experience, continuing education, or a lot of other intangibles that matter. Early childhood educators in Alberta and Edmonton are comparatively low paid, even with wage subsidies. And a fair number do have second jobs, it seems. But overall, thinking about quality, it's just kind of hard to understand. And I make that statement broadly. And our current options for sort of understanding it in Alberta and Edmonton are pretty limited. Our program level distinctions are gone. We do have provincial data that's not always public, but analyzing would be possible. But that would also just give us bits and pieces of things, sort of only parts of the picture. An original data gathering when it comes to quality would be great, but it can be extremely expensive. So the last aspect of early learning and care on our whirlwind tour is exclusivity, or inclusivity, sorry. And again, this is really difficult, and my whirlwind tour is not going to do it justice. But I will note, when we're trying to answer the question, how inclusive is early learning and care in Edmonton? There are a lot of different programs that operate, I would say, in particular for children with special needs or children with disabilities. Early Childhood Services, which is managed by Alberta Education at provincial level, but also implemented by local school boards. This funds programs and assistance both in schools and through some private operators for pre-K children with special needs. It's supplemented by program unit funding, or PUF, for pre-K children with severe disabilities. There have been recent changes to the PUF program, or to PUF in the last year or so. This has reduced the number of school-based programs and locations for younger children with disabilities in Edmonton. Then there is also the Family Support for Children with Disabilities program, which is managed by Alberta Community and Social Services at a high level. That's another provincial ministry. That supports and services to children with disabilities up to age 18 and their families. And then the new inclusive childcare program that Alberta Children's Services is fielding, and the description of that will produce or provide licensed childcare programs with access to provincially aligned training, resources, and supports that enable the inclusion of children with extra support needs. But of course, inclusive is a broad term. It can cover much more than children with disabilities. So we might ask questions like, how inclusive is ELC in Edmonton of low-income families and children, of newcomer families and their distinct cultures? And so we have examples of some here, including the Intercultural Child and Family Center that attempts to include sort of distinct cultures in their education and in their programming. How inclusive is it of Indigenous families and cultures? And there's a new program emerging at Oliver Center that explicitly includes things like language. And then how inclusive is it of families with parents who work nights and weekends? So what we might call flexibility. So I'm sort of shoving flexibility underneath inclusivity here. And so there, sort of in the end, I mean, there are many ways in which early learning care in Edmonton could be considered inclusive, but we don't necessarily have a great comprehensive grip on being able to answer that question quite yet. So that's my whirlwind tour of early learning and care in Edmonton. And I missed a bunch of things, I know that. But now I'm going to move on to the question of what can be done. And so I'm going to start here locally with the City of Edmonton. And I'm going to start by prefacing recommendations or potential options for even arguing why the City of Edmonton should care about early learning and care. And the basic objection that I've heard and is entirely reasonable is, isn't early learning and care a provincial responsibility in Alberta? And the answer is yes, but the city is able to help in important ways. And this is even acknowledged in the new Edmonton City Plan, where they do say part of the plan is to enable accessible childcare facilities in a variety of locations throughout the city. I would also argue that the city, if it deprioritizes early learning and care, risks losing out in the short, medium, and long term. So what do I mean by that? In the short term, early learning and care is important because Edmonton parents need to get back to work post-COVID. This is very important. Most of us have experienced this. And that is actually critical to the City of Edmonton's population. In the medium term, Edmonton needs families to come here, and it needs those who are there to stay. Focusing on early learning and care is about the quality of life. And in the long term, and now I'm going to return back to sort of the council's origins as an End Poverty Edmonton piece, is that if we're going to solve poverty in Edmonton over the long term, we need children here to have solid social and intellectual foundations going into kindergarten. And then I want to say all the time, so across every one of these, without focusing on early learning and care, we risk leaving certain people behind. And in particular, women, in particular, low-income families, shift workers, and younger families. This applies short, medium, and long term. It applies all the time. So if you agree that I have convinced you in some ways that the City of Edmonton should be involved in this, what can the city do? Well, I'm putting forward a few options here for the city to consider. And one is to create a formal municipal early learning and care policy and strategy. And this is the idea of sort of getting all of the things together and having a focus and a set of goals that the city can focus on, and that all of the departments of the city can sort of refer back to. There are numerous cities throughout Canada and elsewhere that have this type of thing, and it's useful for making sure that we don't just have sort of one-off projects that are well-meaning but then don't connect with each other. The second option would be to create permanent entities responsible for early learning and care in the city and delegate some authority to them. So an example of such permanent entities might be a coordinating group. So the city can work in a consistent way over time with other levels of government. As you've probably seen in this whirlwind tour, Children's Services, for example, isn't the only organization involved in early learning and care in Edmonton and in Alberta. So coordination is actually quite key to working under the way it works right now. In Edmonton, Early Learning and Care Information Center. So the city's work could be guided by good information, both qualitative and quantitative. And then an advocacy group that speaks on behalf of the city to other levels of government. Third, the city itself could create and deploy some specific policies and tools to address early learning and care in Edmonton. So types of things that this could include would be a grant program, similar in concept to Edmonton's Affordable Housing Investment Program that aids in the creation of new programs or renovation of existing buildings to put early learning care programs in there. And this is a way the city could focus on childcare deserts, for example, and contain targets for new programs and spaces. Direct support to programs that choose to offer assistance for low-income residents, say a sliding scale on fees. Dedicated space within city-owned buildings, support for programs that offer higher quality program or that increase inclusivity within Edmonton, and then options for developers within Edmonton to devote money or requirements to creating new early learning and care in their area. I wanted to put this in because what I've presented are by no means the only options or where it stops. This is a slide from Kathleen that offers some other options, including things around zoning, safety corridors, and maybe even other options that I haven't thought of or that Kathleen hasn't. And now I'm going to talk a little bit about Alberta Children's Services. So on the provincial level, what can be done to help Edmonton or to help folks, even lower income families in Edmonton? So the first option here is to make it easier for Edmonton and other municipalities to support early learning and care. So the idea is that whatever the city is doing, the province would reciprocate or react to it. So if Edmonton, for example, created an information center, have the province regularly provide local level data and data analysis, perhaps if needed, to that center. Create a formal or established and regular way to listen to municipalities' concerns about early learning and care. So this could be a way for whatever advocacy sort of capacity is developed at the city to have an outlet, a regular outlet to the province. The second option would be to invest more in the workforce. This would help Edmonton, but it would also help all of Alberta. So increasing wage subsidies to increase recruitment and retention into the workforce and to recognize how important and critical this work is. And increase resources for early childhood educators to up their ELC specific education, perhaps eventually with maybe a very gradual increase in certification requirements. And then expand and reshape the subsidy system, along with considering a cap on fees. So one thing that could be done, and I'll talk about this in the next slide a bit, is convert the current subsidy system to what I call slide system, or sliding scale system, and expand it, which would help on affordability. One thing that is interesting about the early learning and care subsidy system right now in Alberta is that newcomer families, so people who are not permanent residents or citizens, are not eligible for subsidies. So in some way create a program or make them eligible. And then evidence actually from elsewhere suggests that just upping subsidies might be met in a system like Alberta's with the programs just increasing their fees to capture more of those subsidies. One way to counter that in some ways is to put a cap on fees. And there may be a number of different ways to do that, but that may need to come along with any increases to a subsidy system. So what you're seeing here is essentially the same picture that you saw before with that blue line around that family. The purple line is what affordability might look like with a generously funded, I'll say, slide system. So one of the things you'll notice about this is not only, and I can go through sort of how the calculations went for this a bit. The idea is that if you look all the way over to the left on the purple line, what you'll notice is the subsidy is high enough that for a family who makes $5,000 a year, it covers their childcare entirely. And then as they make more money, that subsidy is reduced. So you'll see they'll pay some percentage of their income, but it goes up gradually. And then there's sort of little inflection points here, but it's gradual, it's consistent, and it keeps their affordability for these families in a range. Oh gosh, I realized that I forgot about my green and red lines on the other one. Essentially, I had a green line at 10, which is essentially, there's some evidence to suggest that being under 10% is affordable. Being over 20% of your income is unaffordable. And then in between 10 and 20 is kind of affordable. So you see here that this kind of slide system could be used to keep childcare affordable for a large number of sort of lower income families, and then have it sort of gradually increase. The other thing that a slide system does is it changes the shape of the affordability curve, if you will. Instead of being sort of a kind of a crazy roller coaster, it's more predictable and it's gentler, which can be more helpful for a number of different types of families, specifically low-income ones. And these are, I've given 3 options here. They are by no means the only options at a provincial level. Here I'm reproducing Kathleen's slide on the growing trend toward public management at a provincial level, including setting fees that are happening in elsewhere in Canada, wage scales, wage floors, and even managing number and location of new centers in some places. I do want to note before I come to an end here about what I've missed in these policy recommendations that I'm aware of. There's no specific recommendations here for local school boards, Alberta Education, or Alberta Community and Social Services, all of which have critical roles in early learning and care in Edmonton. I'm also acknowledging that the policy options I've given are not sort of fully scored in an analysis sense. One would want to look on how they perform on each one of those aspects that I've talked about. So what does a subsidy do for affordability, but what do other options do for availability or quality or inclusiveness? And also I haven't included cost benefit analyses of these different options. But that said, I want to leave everyone with a larger sort of view and to say, one of the things that in my work with the council, but also in looking at this, is the conclusion I come to that to build a better early learning and care system, we need coordinated and systems-oriented solutions. By coordinated, I mean multiple levels of government working together with similar goals. By systems-oriented, I mean that we can't trust or have one-off solutions. And the analogy I use here are, you can't put out a bonfire by throwing snowballs at it, right? You have to do something else. Or solutions that just address one aspect of early learning and care. And the analogy here is, if you have a leaky dam with multiple leaks, if you put your finger in one of them, that just forces the water to go to the other leaks. So in some ways, what this means is that trying to address a problem like affordability in isolation might cause problems for quality or inclusiveness or other things. So the idea in an overarching sense is that we need packages of changes that operate simultaneously at various levels that address these multiple aspects of early learning and care at the same time. That's hard. There's no doubt about that. One overarching option that switches out issues is to mimic or expand the K through 12 system that we have right now. That does switch out some problems for others, but it solves some things. And so that's to say that we don't have no examples in front of us of how this can be done, even locally. But the overarching idea of coordinated systems-oriented solutions, I think, is the biggest thing to take away from that. So that is my presentation for now. Thank you very much. I'm going to stop sharing here. And I'm happy to take any questions from the chat or from elsewhere. Thanks, Karen.
Thank you so much, Rob. Lots of really great questions coming in the chat, so I will not hesitate to start off. There was a question that says, have you examined the possibility of the City of Edmonton operating childcare programs as public childcare, as with the school system, that can ensure services are equitably available across communities?
Have I examined it myself? No. There's a lot in that question, though, to be honest, and it's real. Like it's a great question. I will say that the City of Edmonton historically did operate sort of public childcare programs, and in fact, sort of historically, that's very common. And there are places in Alberta that still do this, other municipalities that still do this. And for some reason, they're escaping my mind, and I'm sure in the chat, some folks would put it there, but they do exist. And the city, it's certainly an option. So it's certainly an option for the City of Edmonton to do that. Part of there's, pros and cons. These things can be expensive. Thank you. Yes, Beaumont, and there are others it's expensive, and it does require the City of Edmonton to sort of build expertise in this. And that's something that would be a choice that the city would have to do. Now, there are many different ways to do that, to build that expertise. But one of the nice things about doing something, sort of having a publicly funded and publicly run one, is that you can, in fact, sort of choose to do with it what you will. You can make a sliding scale for lower income families. You can choose to go to different income or choose to do different quality levels. There's a lot of sort of really creative things that a city managed and owned program could do.
This is maybe a bit of a nuance on that, but somebody asked, how challenging would it be for the city to allow certain housing complexes to convert floor level apartments to on-site childcare spaces?
Well, I wish I had a lot of experience in that, because I actually couldn't point out all of the various issues that would be involved with that. That's a great idea. I know one of the, in terms of planning and in terms of sort of thinking about how we develop, especially within the city, the idea of sort of having ground floor be, retail or other, or sort of non-housing, and then the housing be on top of it is very popular. And having something that's actually included in a development, I mean, that could be, like, I'll speak as a parent here. Oh, that would be amazing. That would be, so that's certainly possible. And there's, I don't think any, there's probably all sorts of considerations we'd have to think about, but that would be that's a very good idea.
The next question is, do you have any thoughts on what the province could do to encourage employers to play a role in creating childcare spaces for their employees?
Well, the province has a lot of options for how they would want to play things out. So encouraging, you can use grants, you can use direct funding, you can use subsidies. There's a lot of different policy options that you can use for that. One of the, there are pros and cons to going through employers for that. One of the ideas at the University of Texas Medical Branch, where I worked and did schooling, there was a childcare that was run by the university. Unfortunately, a hurricane hit Galveston in 2011 and made that entire building unusable, and it never came back. And that was in part because the university just had a really hard time recovering themselves and then trying to figure out, in all the multiple things they were doing from the hurricane, how to make that happen. And to this day, that building actually sits unused. That's not saying that would happen to everyone, but that's sort of one thing that can happen if you go through employers. But the province could absolutely offer incentives to employers to offer early learning and care, and it could also include sort of requirements or requests that go along with those with subsidies or additional incentives for that.
Thanks. The next question is, how might Alberta education funded programs like PUF better support individuals' support needs across settings? So from ECS through to school, through to childcare.
I'm going to beg a lot of ignorance on that one. PUF and ECS in general is just very complicated. I will say that the recent changes that I just sort of touched on, they're very recent, and they did shift PUF funding considerably. One of the big things that happened was that PUF now doesn't support children in kindergarten. Children in kindergarten have been moved to a different grant that covers children in K through 12. There are a lot of sort of commentary, and there's a lot of things that have happened in response to that, but we're still awfully early in sort of understanding that. So part of my, I'm sorry for sort of shifting the question here a little bit, because I don't want to talk out of turn too much, but I would encourage all of us to kind of be aware, and I would hope also from Alberta Education's perspective to kind of monitor what happens. This is a big shift in a big program, and I'm very curious to know how this will shake out, and what that big change will mean.
What might be done about childcare deserts? You mentioned those early on in your presentation. What might be done about those childcare deserts in Edmonton or even in rural Alberta, rural areas in Alberta? Do you have any sense of whether COVID has made scarcity worse?
I would love to be able to answer that. I'm going to take this in reverse. Do I know whether COVID has made scarcity worse? Not quite yet. I mean, and I say that from someone who monitors the provincial open data probably too closely. But that's how we would know. The province of Alberta, to its great credit, every 3 months comes out with a list of where programs are in the province, what type of program they are, and how many licensed spaces they have. And so what you saw in a lot of this presentation is actually based off that data. So right now we know we have March 2020 data, we have September 2020 data. Still waiting for December 2020 data. I think comparing March to December might be the better way to look at it. In fact, one of the projects that we're hoping to engage in the next few months is trying to look at, say, differences between rural and urban areas of Alberta in terms of how COVID hit them. So I have been hearing anecdotally, though, that there are some rural areas that are really feeling the pinch. And I think one of the things to think about here is that in many rural areas, it's not that there are not 10 programs, right? There's only a couple. And so losing just one has a disproportionate impact on the families that are even within 50 miles of those programs. And so that's one thing to sort of think about, and hopefully we'll be looking at that more. As far as childcare deserts in particular, there are a lot of options to try to think about adding spaces. And one thing that's very important to think about when you evaluate or think through childcare deserts is deserts only look at one aspect of early learning and care, and that's what I called availability. You could cure childcare deserts in Alberta by putting in super expensive childcare in a lot of different places. I'm not sure that you've cured deserts. I'm not sure that actually hasn't caused a problem elsewhere. So I really do think childcare deserts are a good way to sort of look at a broad sort of like one aspect, and they're a good way to put things together in a way that kind of puts different aspects together. So a desert represents number of spaces and kids eligible. And it's often really easy to just look at childcare or early learning care and number of spaces and not go any farther than that. Childcare deserts are a really good way to smush those together. But again, we're only looking at availability in there. And there are many different options for increasing availability. But again, we have to look carefully at whether plugging that leak in the leaky dam causes the water to go elsewhere.
This is an interesting question. Would there be benefits to working with high schools to create more childcare spaces in a neighborhood? So teen parents could also use the service so they could continue their education, and it could provide students a work experience placement.
Oh, that's a great idea. And
write that one down.
I'd love to see it. I'd love to see it in every school. It brings up something actually that I kind of blew past in my presentation, which is the idea of purpose-built spaces in schools for early learning and care. So I am. This is an idea that is wonderful, to be honest, and it works really well for any number of reasons. If you have an early learning and care program located in a school, depending on how far up that school goes, it's often going to be a primary school, right, or like a K-6 school. So it's not like you would necessarily have a sixth grader seeking to get work experience in that early. But having those there does allow interactions between different ages of children. It allows continuity for parents and children as they grow older. But it also gives an easy hook in for students in high school to sort of go into those programs in a comfortable area to get some work experience. I mean, that's a wonderful idea. I'd love to see that happen more and more.
I think maybe we could squeeze in one more question. We're near the end. If people are on their way out, please do look at the chat box because there is a link to our survey, which we will also send out to you through your Eventbrite registration. But I'm going to squeeze in one last question to Rob. And this one actually I remember was a little bit of something that Kathleen mentioned in her February 24th one as well. But how do you think that the City of Edmonton could get involved with the federal government's plan for a national childcare system?
That's another fantastic question, and I wish.
Great one to end with, eh?
I know exactly.
No end of complexity there.
But I think one of the issues that we're running into is that national plan is emerging, right? We're learning more and more about it, and I think one of the important parts generally for the province and for the city, and would be to sort of be ready in a way, like to sort of say, well, however this program comes out, have options on the table that are available, have ways that money from the federal government, however it comes down, could be used to sort of flow into different types of areas. How do we use federal money, for example, to encourage purpose-built early learning or purpose-built spaces in schools? How do we use it to assure affordability? How do we use it within even Edmonton? Are there ways to sort of flow it to different types of programs that would be more inclusive? So I think part of it is to encourage the province and the city to be ready rather than to be sort of on their back heels and reactive. So I know that's broad, high level, because I don't know all the details of what's coming down from the federal government, but that's sort of encouraging and sort of proactive work on all levels possible.
Fabulous. There's some great conversation in the chat as well, and we appreciate everybody's time today. I want to thank Rob so much for sharing your insights today from your work with the Edmonton Council for Early Learning and Care, and also thank everybody participating for their engagement in a great conversation. I want to remind everybody that the third set of talks in the Issues and Impacts series will take place in May. So please watch our Eventbrite channel for the announcement for registration. And I'm going to plant a little bit of a temptation for you to let you know that that will be focused on evaluation. And we're going to have two of the finest evaluation minds we know coming in for our field expert talks. We don't have our date yet set, but we will soon. So please stay tuned. Thank you everyone today for coming. And we look forward to seeing you again in May. Thank you so much, everybody. Be well.